Okay,
Yeah.
all right, I think we're good to go, Chair.
Okay, thank you. Welcome, everyone. This is Wednesday, August 25th. It is the regularly scheduled meeting of the Lincoln County Board of Commissioners. It is 10:02 a.m. We are meeting virtually, and the first item is to call the meeting to order, which I have now done. Next item is to establish a quorum. We have all three commissioners present. Next item would be the adoption of the consent calendar. These items are of a routine nature or items that have come before the Board of Commissioners previously. Staff or commissioners may highlight an item at this time if they wish. Otherwise, I'll entertain a motion to adopt the consent calendar as presented.
Mr. Chair, I move we adopt today's consent calendar as presented.
And I will second the motion.
It's moved and seconded. All those in favor say aye. Aye.
Aye.
Aye.
That motion carries. Thank you. Next on our agenda is a public hearing. This is a petition to vacate a portion of Clark Loop County Road number 567. And the presentation will be by Public Works Director Kenyon. I will open the public hearing. And first request staff report.
Good morning, commissioners. I'm Roy Kenyon, Lincoln County Public Works Director. And Casey, could you scroll up to the first picture, please?
Yeah, can you see the PowerPoint right now, Roy?
Yes,
Okay.
very good. Thank you very much. The county is in receipt of a petition to vacate a portion of Clark Loop, County Road number 567. Clark Loop is located immediately east of the Toledo city limit and on the north side of Highway Business 20. Clark Loop is an old section of state highway, extremely old. It is generally located as you're leaving Toledo headed east. It's on your left-hand side. Now, the significant part of Clark Loop is that in 2007, there was a vacation approved on, let's say, the south end, or if you're as you're looking at the picture, it would be the bottom of the screen. As you can see, looking at the green lines that identify right-of-ways and property lines, there are no green lines on that section of Clark Loop. That's because that portion was vacated and became part of tax lot 2300 that is owned by the Cornwells. Now, what the intent of this vacation request is to vacate that next section up that is immediately adjacent to tax lot 3100 that is also owned by the Cornwells. Their intent is to try to gain additional space on this tax lot to create a tax lot that they could actually sell or build an additional residence on. County requirements are for that on a tax lot like this adjacent to a public road right away that there is a 20-foot setback for any residence. So as you can see, this tax lot 3100 is fairly long and thin, and so you have the 30 feet on their side of the right of way plus a 20-foot setback. So there's really roughly 50 feet to be gained there by this vacation petition, this request to vacate that right of way. If it was vacated and that property line was changed and moved out to the middle of what is now the right of way, there would only be a 5-foot setback requirement for a structure. And that because that would be then considered a side yard setback, not a front yard setback. Casey, could you scroll up to the next picture? That hashed mark or hashed area there is the vacation request in its entirety. And as you can see on the north end of that, or on the top of the screen, there will still be a section of Clark Loop remaining. Therefore, there will still be public access to that lot, to that area. And just to the right of that little section of the remaining piece of Clark Loop, there's kind of a big open area. That's actually right away for what is now Business 20. And so there's a large piece. There's basically, we're not, by this vacation, we're not limiting any kind of public access to any of this area. There will still be public access to that area. Now, the Saxes, which basically own the lot in the middle of the screen to the left, they actually access across the Cornwall's property on the south end. And that, it was an agreement, like I said, that came up in the 2007 vacation. They have an easement agreement that crosses that. They don't need that. They don't need the vacated area or the potential vacated area to access their property, although they also would get half of this right away. And so they would still have access to their property from the north end through that remaining portion of Clark Loop. In the petition, the county received 100% of the signatures from the abutters. So I kind of got ahead of myself. Casey, can you scroll back, please? So we have signature sheets from the Cornwells on tax lot 2300, from the Cornwells on tax lot 3100. We have signature sheets from the Saxes on tax lot 2200, and we also have a signature sheet from the Joneses tax lot 2100. That dark line that surrounds the Sax property, tax lot 2200, is actually the city limits of Toledo. And so the city limits actually butt up next to this proposed vacation. I reached out to the city of Toledo. They did respond. They are not opposed to this vacation request. Their only comment was that they were wondering about frontage, the Saxes losing any kind of public road frontage. And I did explain to them that the Saxes would still maintain public road frontage on the north end of their property. If this was vacated, they would still have a 30-foot strip there on where to be the north end of the vacated area. So they did not lose all of their public road frontage. Other than that, City of Toledo had no comment on this. So the vacation, if approved, will not have any impact on the traveling public. Due to the 2007 vacation on the south end, Clark Loop has not been a loop since 2007. It's actually been a short dead-end county road. If this vacation is approved, it becomes a shorter dead-end county road. So yeah, I'll show you a couple pictures. Casey, scroll up to, would you please? One more. There we go. This is basically looking at the area that is proposed to be vacated. As you can see, there is still a road there. I guess it sounds like the Cornwells use it and some of the neighbors actually use it. But for all intents and purposes, it does not go through. It crosses private property back beyond the Beehive, back there where those buildings are. That's actually was part of the 2007 vacation. And so that's private property. There is no legal access through there, although there is a physical access through there. This is looking basically north from the 2007 vacation, and what we're looking at vacating here is basically the area where the fence is, including the rock road there, and what you see is a narrow 10 to 12 foot gravel road, but the actual legal right of way here is 60 feet, and that's really what is restrictive as far as the building on the lot taking up the room. There's both sides of this 60-foot right of way are 20-foot setbacks, and so by vacating this, like I said, it creates a buildable lot for the Cornwells, and I guess in this day and age, especially in Lincoln County, buildable lots are few and far between, especially in the Toledo area. I know there's a big push to try to get more housing. And so therefore, if if you choose to approve this vacation, like I said, one, it has no effect on traveling public. Two, we have signature sheets from 100% of the adjacent property owners. And three, I do believe that it's in the public's best interest to approve this vacation, basically only on the point that it does create a buildable lot, tax lot 3100, that then will allow for one more home in the Toledo area. Chris Cornwell, the petitioner, is actually here with us today on Zoom. So if you have any questions for him, he is available. So thank you.
Questions or comments from commissioners? Commissioner Jacobson.
Yeah, I think you kind of summed up exactly what I was going to say, Director Kenyon, which is that, we have agreement from property owners. This does not, make a safety issue for the traveling public or anything like that. And I absolutely agree with you that it is difficult to find space to build in Lincoln County, in the Coast Range. And, even though this is just, one buildable parcel, I think that does make a difference, obviously, to that family and our community as a whole. And we have such a housing shortage here. So I don't have any further questions, but I am in favor of the vacation.
Oh, and just to add to that, I did some very simple math, and don't quote my numbers, but tax lot 3100 now currently is roughly 10,000 square feet. And if this vacation is approved, it actually increases the square footage to 15,000. So basically like, what do you want to say, increases it by 50%.
Mhm.
So, and like I said, it's one of the setback things. You go from a 20-foot public road setback to a 5-foot side yard setback. So.
Commissioner Hall, any questions or comments?
No questions, just the comment that it really seems like a pretty logical and about as uncontroversial a vacation request as we're likely ever to see before us. So I'm in favor.
Okay.
I had a quick talk with Assistant Counsel Herbage this morning, and we agreed that for various reasons, we're not going to require a decision from the board this morning. We're going to basically have you close the public hearing and then continue on to next week meeting for a decision, and then Assistant Counsel Herbage could then prepare the paperwork if necessary.
Counsel Herbage.
Thank you, Commissioner. For the record, this is Counsel Herbage, and I did have the discussion with Roy Kenyon this morning, and I'm fine with his recommendation, which is for the chair to go ahead and close the hearing and for this to be continued to next week's meeting for a decision. If that's fine with the board, you could make a motion to that effect.
All right, before I do that, I understand that the Cornwells are in attendance virtually. Do they wish to offer any comments for the record?
No, that's fine. Thank you for the invite to attendance, and this is all very interesting, and I appreciate it, and thank you. No comments.
Well, I will acknowledge you, Mr. Cornwell, in that I walk by the vacated end of Clark Loop almost daily on my walks. So it's nice to have a face virtually, if you will, with your name. Any other individuals wish to comment on the petition in favor? I'm kind of looking to you, Casey.
Yeah, thank you, Doug. I see no raised hands and I believe we've got it covered.
Anyone wish to speak in opposition? Again, Casey, no raised hands.
Nope, scanning again and nope, don't see any indication.
All right, then Council Herbage, I believe it would be appropriate to close the public hearing and then move to address or make a decision on the issue next week, or do we want to make that decision in the public hearing?
No, you don't need to make it in the public hearing, so I would go ahead and close the hearing first and then maybe just move to continue this till next week for a decision.
Okay, public hearing is now closed, and as requested, I'll entertain a motion to continue this process for a decision to next week, September 1st at 10:30 a.m. In the virtual Board of Commissioners meeting at that time.
I'll make a motion that we continue this until September 1st at 10:30 a.m.
I'll second that motion.
Any other discussion? All those in favor say aye. Aye.
Aye.
Aye.
All right, that motion carries. Council Herbage, anything else we need to do on this matter at this time?
No, Mr. Chair, thank you.
Okay, thank you, and thank you, Director Kenyon, and thank you to the Cornwells. All right, we'll move on. Next is a discussion information item on the insurance payout for a totaled vehicle. I guess the good news is we don't have to do this too often, but Director Kenyon, give us an update.
Good morning once again. I'm Roy Kenyon, Lincoln County Public Works Director. And also I oversee county fleet services. And we are currently in the possession of a 2013 Dodge Journey that was in an accident. And it actually was by CIS, by the county's insurance, was this considered to be totaled. Now their payout for this, they've offered $11,294 for this vehicle. According to Mark Melnack, who is our fleet supervisor, he would consider that a high book offer. He was very pleased with that. And so the request is that we ask the board to accept the insurance payout. And then also, because we are now down one vehicle, and this vehicle was used by juvenile probation to transport individuals, that we get approval to replace this vehicle. As you can see from Mark's request on the screen, the estimated cost of a new minivan, it would be up to $31,000. I think he actually has one out there that he would like to attempt to buy. And so we will need an approval from the board to actually get this done.
So are you looking for a decision today?
It would actually be nice if we had a decision today, because basically what he's looking at is something that is kind of open for bid right now. And he would like to actually get the purchase done as soon as possible. He said that if we did get approval today, that he could actually try to get it purchased before the end of the week.
Okay. Questions or comments? Commissioner Jacobson, it looks like your microphone's open.
Oop, sorry, I never actually muted myself. No questions or comments for me.
All right. Well, I sense that this would be a decision that by making it today would help the county and take advantage of a potential opportunity to purchase a replacement vehicle. So unless I hear comments to the contrary, I'll entertain a motion to approve the insurance payout for the total vehicle and to purchase a replacement minivan.
I so move.
I second.
Any other moved and seconded? Any other discussion? All those in favor say aye. Aye.
Aye.
All right. Thank you, Director Kenyon. You can now direct Mr. Melnick to purchase a new van.
Well, thank you very much, and I will call him right now.
All right. All right, we'll move on to approval of an ambulance for the Depot Bay Fire District. I believe Chief Jackson is with us virtually.
Yes, I am here. Good morning, commissioners.
Good morning.
Let me get my video started. Well, basically, I wanted to present to you that we have an opportunity to obtain an ambulance, and this came way of a discussion with Jamie Mason, who's the chief over at Central Coast Fire Rescue. And they no longer have a need for their ambulance. This particular ambulance is licensed and already equipped for transport, but over the course of the last several years, they have gotten out of or gotten away from the transport services. What they are in need of is something that Depot Bay possesses, and it's a rescue squad, so that they have the ability to utilize basically a robust response in their district without having to roll in an ambulance. Secondly, we have been in pursuit of an ambulance for a little while now, and talking with the state. The state basically requires us to get approval from Lincoln County before we move forward with the licensing procedures for Depot Bay specifically. Long and short of it, over the course of the last 10 to 15 years, call volume has increased throughout the county for fire and EMS response. And it's really taxing the system at this time. And what Depot Bay would like to do is actually obtain this ambulance to create a more robust emergency medical services response. And again, we need the county's permission to be able to move forward with that. Let me just kind of throw in there that Depot Bay Fire District at one point had their own ambulance, I think as late as the early 90s. And with the coming on board with Lincoln Ambulance and then Pac West Ambulance, Depot Bay Fire District found it not to be advantageous for them to continue to provide ambulance service. But here we are today, and again, increased call volume, and we want to be able to provide that service to our citizens when the system gets busy. And we're looking for an endorsement or an approval letter from the county to be able to do that. Now, I've spoken with the Oregon Health Authority, who basically stated that we needed to get your permission. And I've also reached out to Dr. Leslie Ogden, Dr. Audra Wisham, spoke with Jeff Mathia personally about this, and Chief Rob Murphy, who are all in support of this. And we would really like the ability to move forward. Let me also add in there that we are not in a position, nor do we have an interest of pursuing the ASA at this time. And this is all coming together at this point. And once the approval is sought and hopefully pushed forward, we will be working with Pac West on a mutual aid agreement to provide that service.
And okay, I see your microphone's off, so I'll assume your comments are concluded at this time. Before I ask commissioners, I'm going to inquire of our legal staff. I believe County Counsel Yule is on the or involved with the ambulance service area. I assume staff is supportive of this request?
Yeah, good morning, Commissioner. So that is correct. I spoke with Chief Jackson, and as he indicated, he's not interested in bidding for one of the ASA assignments. To be able to operate this ambulance, he would need your permission, and he would also need the mutual aid agreement, which it sounds like he's pursued and has approval to do that. So Essentially, we had this kind of arrangement down in the South County when Central Coast was operating. They had a mutual aid agreement with PacWest, or PacWest had a mutual aid agreement with them. So this is not unusual to have these type when you have a busy season, especially in the summertime.
Okay, thank you. So I guess to summarize your comments, you're supportive of this request.
That's correct, Chair.
Okay, thank you. Questions or comments from my fellow commissioners? Seeing none, are we comfortable in acting on this today, or would we like this to come back next week?
So why don't you see if you get any comment and public input on this, but otherwise we can bring it back for an order at next week's meeting on September 1st.
Okay, public comment virtually?
Or if they submit it via email.
Okay, so I think the consensus then is that we support this, but we'll make a decision on it next week to allow for any public comment.
Yes, that would be great.
Okay, seeing no negative nods from my fellow commissioners, we'll have this come back for us to us for a decision next week, which will be September 1st. All right, next, I will say this is an exciting item for me. This is something that I know my fellow commissioners and I have wrestled with. The surge of the virus is creating unprecedented challenges. The beleaguered Health and Human Services staff and our partners and volunteers are just buried. So here are some things that I think will indicate that we're concerned and trying to be supportive and appreciate the hard work of all of the people. So with that, I'll turn it over to our County Counsel, Kristen Yule, and the Director of Human Resources, David Collier.
Thank you, Chair Hunt. Is Mr. Collier on the call?
Kristen, this is Casey. I just realized he does not appear to be on the call, and
Okay.
Christy Peter is calling our personnel office right now to see exactly what's going on.
Does he need an invite?
I'm not sure. I know she's working on it right now.
Okay, that's fine. I can start the conversation. So Chair Hunt, as you're aware, since the COVID surge, we've been having discussions in the county about how to address this, how to support our employees. As you're aware, previously the federal government had issued COVID relief leave, and a lot of employees had utilized that. And that was for when employees, for example, were waiting on test results for COVID-19. Perhaps they were told to quarantine. Maybe they had a family member they were caring for, or a child that was quarantining or actually had COVID-19. So that leave expired at the end of last year. And there's been discussions about how can we support our employees as we hit this new wave with the Delta variant. So some thoughts that have been discussed, that your idea was, what about providing employees with some COVID leave? The county would provide them. We're recommending up to 80 hours extra sick leave just for COVID. I know Director Collier has been preparing a policy to that effect. It would be effective upon you making a motion and the board approving it. But essentially that COVID leave would mimic exactly what was offered last fall. So anybody on quarantine, anybody sick, waiting for test results, or caring for a family member. Anybody have questions about that from any of the commissioners? I know Director.
Commissioner Hall, Commissioner Jacobson, any questions? I'll provide a little bit of information. Correct me, Counsel Yule, but I would suggest that this opportunity for leave be effective with the approval of the personnel amendment, which I expect would be September 1st. and continue through the end of the calendar year, which would be December 31st of this current year.
This is Commissioner Jacobson. Just a couple of comments. One is, I think right now with what's happening, around us, which I'm sure we will get more into later here as our meeting goes on, I think we do need to reinstate this for our employees as a way not only to support them, but also to help, slow the spread. And I think it's really important that we get this in before school starts. Lincoln County School District is still going to do an in-person model, which personally I am grateful for, so I can get my children out of the house. But that does mean that kids potentially might still be exposed and need to quarantine. So I think this is important for employees and their families. As far as the end date of December 31st, I'm okay with that. But I think that before it just ends, we should probably maybe put this on our agenda for early December to discuss, to see if this is something we need to, have extend into the following year or not, just depending on what is going on at the time. So maybe we could just make an agenda holder to discuss in early December.
Okay, sounds good to me. Commissioner Hall, any comments?
Yes, I am supportive of this for all the reasons discussed.
Okay. There are other items relative to this agenda item. Do you want us to address them individually, Counselor, or?
Sure. And so just to finalize that, Mr. Collier is preparing a policy to address the leave, and we will bring that back next week. It's going to be a temporary amendment to the personnel rules, and you will be able to act on that. So we will bring that back for September 1st.
Okay.
One of the ideas Commissioner Hunt had was to provide a bonus for employees who have been fully vaccinated.
So in fairness, full disclosure here, it came out of a conversation with our finance director, Christina Shearer. So the credit goes to her as far as originating the idea.
So some idea, I know the state has implemented that. I know some of the tribes across the state have also given bonuses or had like lottery drawings, which is a great incentive. So this idea of providing a bonus, it would be used from the ARPA funds, is my understanding. So currently right now, some employees in Health and Human Services and healthcare are providing proof of vaccination as required by the state. So any individual who would want to take advantage of this bonus opportunity would just provide proof of vaccination to the county. We will provide that information, obviously is kept confidential by personnel. So this is, the idea is somebody who's fully vaccinated. So currently right now for Moderna and Pfizer, you need 2 shots. For the Johnson & Johnson vaccine, you just need 1 shot. So we can bring that back in the form of an order for you to consider next week. We will have details of where the funding is coming from, how employees would be able to show proof of vaccination, and then giving an opportunity for individuals to get vaccinated. And so I'm looking for guidance from you 3 of what kind of timeline do you envision allowing people the opportunity to still get vaccinated and take advantage of this bonus. Any thoughts?
Well, I'll go first since I've had the discussion with the other staff members. I envision this to be an opportunity for any county employee to get a $500 one-time payment if they show acceptable evidence of being fully vaccinated. And I would expect that anybody that is willing to do that, or anyone that gets fully vaccinated between now and, I would suggest October 15th as a deadline. I think that's consistent with some of the other deadlines that the state has in place. Anyone that shows the acceptable evidence would receive a one-time $500 bonus payment, and that payment would either be a part of the October 25th payroll or the November, I'm not sure what date, well, it'll be November 10th, whatever day of the week that is. And again, I would see it being available to any county employee, regardless of whether they're part-time, full-time, whatever in between. That's my thoughts. Fellow commissioners, your thoughts?
That all sounds reasonable to me.
Yeah, I was actually trying to Google something so that I could kind of respond to the timeline piece. I guess the one thing I just want to, be cognizant of is that in order to be fully vaccinated, there obviously is that for Pfizer, at least, it's 21 days between number 1 and number 2. I was trying to look up how long it is for Moderna, and I don't remember. So I think it's about the same.
I'm
the same
Moderna,
time.
and it was 4 weeks between the first and second shot.
Okay, so I guess just the one thing I'd like to, make sure that we have time for is, and I'm supportive of this. If we were to put this in place, let's say next Wednesday, which is September 1st, so that's when it becomes policy, people start getting their shots within a week or two. So they do it by like the 15th, 1, 2, 3, 4, you wouldn't be fully vaccinated until like the 6th of October if we're allowing them kind of 2 weeks from when we make it policy to actually go and do that. So I just want to make sure that we're not making the timeline so tight that people that have not gotten vaccinated don't have time to actually use the incentive and get it done. So I think you were proposing the 13th. Is that correct, Commissioner Hunt?
I'm the 15th, but I'm open to, 20th, Halloween.
Yeah, maybe I would just say maybe the end of the month, October 31st. And then I feel like, people have adequate time to take advantage of the opportunity.
Yeah, I think that's a good point. The idea is, hopefully it encourages some people to get vaccinated and rewards the ones that have. And I think that's good. Obviously, we'd have to delay the payment date to either the 10th of November or the 25th of November, but I'm sure that can be arranged.
Yeah, I just, like I said, I just want to make sure that there's adequate time. And, when our policy comes out, the next thing you do is look for a vaccine clinic, and maybe you can't make the one the following week or whatever. You're looking for one where you live or one that's after hours. And so I just want to make sure there's a pad of time so that people can take advantage of that. So I think October 31st, which again would move the payment back, as you said, I think I'd be more comfortable with that.
Okay. Commissioner Hall, you're shaking your head affirmatively.
I am.
Okay.
Yeah, this all sounds very reasonable, and I expect by next meeting we'll have all these details ironed out and we can formally consider this proposal.
Yeah. I might note that these payments would be before tax, just for the record. Any other direction needed from us, Council Yule?
No, Chair Hunt, I think I have everything I need with a new date for a deadline of when to provide the vaccination status. So I will prepare the order and for your consideration next week.
I guess I have just to have one more thing to kind of note on this, just so it's clear that, we do have some workers that do fall under the working in a healthcare setting category, as defined by the state, that have to be mandatorily vaccinated. I know there was some email traffic, Commissioner Hall and Hunt, you may have as well, about, if what was on our agenda was mandatory vaccines, and we're talking again about an incentive, but we do have employees that fall under state rules for being mandatory vaccines. And so, those employees that have to have a vaccine by state order would still be able to receive the incentive, even though they have to, as well as people that don't have an incentive for their, or don't have a mandate for their position would also be able to get it. So I just want to make that clear that if you have to, by state rules, that you'd still be able to get the incentive.
Anyone who is fully vaccinated, regardless of when
Yeah.
or why.
Well said. Thanks.
All right. Couple other items I know we discussed. We discussed free test kits, Council Yule.
That's right, Chair Hunt. So one of the ideas is to provide these self-test kits that employees will be able to have at home if employees are not feeling well or have a concern that they may have been exposed. These kits would be at their disposal. They could use it obviously for a family member, a child. So our idea is to provide 2 kits for each employee. And that was kind of just another idea while the surge is happening. So people are safe, people aren't coming to work if they maybe are unwell. So that's the idea, about 2 kits per employee, and we're hoping to order these soon and distribute these. So I don't know what the thoughts are from the other commissioners, if this is something that you're supportive of.
I think,
Commissioner Jacobson.
yeah, I think this was one of my babies, and yeah, I'm very supportive of it. I think that our employees having access to testing, again, especially as schools in session and that sort of thing, I think is really important, again, to help reduce, workplace outbreaks potentially, and our employees, many of them have a lot of direct contact with the public, and you might be sneezed on or might have to be in close proximity. I'm thinking of many of our first responders, and just be able to have that peace of mind and test, I think would help them out, as well as, like I said, preventing any potential workplace spread we may have. So I'm fully supportive of that.
I'm supportive of it as well.
I might note, I think that a test kit, if it were to be purchased by an individual, is somewhere in the neighborhood of $25 or $30. So again, these would be made available, 2 test kits per employee at no charge. All right. Last thing on my list relative to this is just, I guess, more for county employees, but certainly I think we want to go back to as much remote work as possible. We will continue to have our Board of Commissioner meetings virtually, and certainly, limit in-person meetings, or really to try to avoid them if at all possible. So again, from a county standpoint, guidelines would be to encourage remote work wherever possible, discourage face-to-face meetings, and again, we will continue to meet virtually as a Board of Commissioners. Any other thoughts or comments? All right, well,
I would just say I do have a lot of comments about what's happening in Oregon right now with Delta and some of our neighboring counties, which is terrifying, but I will leave those to when we get into our COVID-19 update with our public health here in a little bit.
okay. Understandable. All right, Kristen Yule, anything else? I think this is a good variety of activities that show appreciation for the hard work of our employees and partners and volunteers, and hopefully will help build morale just a little tiny bit.
Agreed. And we will bring these back for action on September 1st.
Okay. Thank you for that. All right, we'll move on to Echo Mountain Fire update, and then we'll get to COVID. And I'm not sure who's doing Echo Mountain. Is that you, Commissioner Jacobson, or
I believe
PIO Miller?
Casey and I are going to do it together and team
right.
up here.
Update us.
Yeah, so Casey, do you want to kick off?
Yeah, I think one of the things we should announce is that the 1 year later reflections event this Saturday to recognize the anniversary of Echo Mountain Fire has been canceled due to these COVID concerns. And And we've been kind of scrambling to get the information out because I sensed that that was going to be well attended and really much needed too, a storytelling event to allow people to share what they've been through. Katie, you were going to be one of the individuals speaking up there, but I think it really was the decision of the long-term recovery group. This was not a decision that was made by Lincoln County, but I think I've talked to Katie. We support that this is probably a good time to really minimize risk in our community. But with that being said, CORE is still available to fire survivors, a very valuable service for folks to deal with whatever they're feeling as we are nearing the anniversary. So I think, I guess postponed is a better term, not canceled. There is hope to schedule something to serve everyone in the future. We don't know exactly when that'll be at this time. I think things are just too crazy right now with COVID to make that kind of a determination. So yeah, be aware of that. A few thoughts on cleanup that's getting closer to being done. And that activity is still going on up in North County. And I think for the most part, that's what I have. Katie, I know we met with FEMA again this week and things are still moving along. So I'll hand it off to you.
Yeah, thank you, Casey. So a couple of updates. One is I just wanted to give an update from county planning on what we're seeing in terms of permits for rebuilding. So again, this isn't total permits processed in county planning. This is permits processed for homes being rebuilt. And so in terms of homes that are completely what they call finalized out, like you're done, you can move in, all of that stuff. They have one site built that's finalized out. They have 6 residential manufactured homes that are finalized out. I will mention this was also from 10 days ago, so things might be a little different now. They have 62 that are electrical finalized. So, moving towards that process, which is really exciting. 1 mechanical finalized, and then 2 structural final that are not homes, but 1 garage and 1 pole building. So, with about 300 homes lost, we're actually seeing quite a few that are moving through the process. So I know it's been a really challenging time for our planning department trying to keep up on that. And there is some state resources hopefully coming in. We at least have an email confirmation that we will be receiving $180K, which we can spend over the next 2 years, coming from LCDC to help the planning department however they need help. So hires or contract workers or contracting more building inspectors or however it is they feel they can use that resource to make sure that we can kind of keep up with this issue. Additionally, several weeks ago, we launched our septic and well water program. Big thanks to Asia for helping support that internally, as well as Chrissy Lucas with OSU Extension Program, who's kind of our external face. We've received so far over 50 applicants to that program. And we have committed about $50,000. This is money that the state gave us actually for this program as a way to help uninsured or underinsured persons get home as septic and well water inspections were becoming a major barrier. So that is off and going, which is super exciting. And some of the first inspections and repairs that this program is paying for is actually happening this week. So exciting to see some forward progress kind of happening. Oh, there it is. Thanks, Casey. Yeah, we have this in English and in Spanish, as you can see there, really simple, less than 5-minute little program or little online thing. If you're not someone that uses computers and you can't do it, then you can call either Chrissy or Asia and they will do it over the phone with you. So you don't have to be a user of computers in order to get through this. We'll help you with that if you need to. Additionally, on a note related to cleanup, the kind of ongoing saga we've had is, the state has been our recovery, cleanup partner. They did the cleanup, or a lot of the cleanup. We also had some volunteer cleanup efforts as well. But the state was responsible for cleaning up the Salmon River RV Park. FEMA, who was reimbursing the state at 75%, came out kind of early on and said that FEMA would not reimburse the state for that cleanup because it was a quote a commercial property. I will say that there is other quote commercial mobile home parks in other counties that FEMA paid for cleanup on. So we have helped the state with that appeal. The first appeal was rejected. The state is going back at it again. And we have been asked to again write another letter helping them with their appeal. This time, last time we really focused on kind of the unfairness of the situation. And while that this was quote a commercial property, these were people's homes, it was residential. This was not like a tourist RV park or something like that. This time, the state would like us to focus more on kind of the environmental aspects, that it's near this, I shouldn't say near, it's right on the Salmon River. You wouldn't want debris and harmful materials getting into that system. We have endangered coho there and those kinds of things because the human appeal didn't work. So we're trying a different way. So I am hoping that we can kind of have a consensus to ask staff today to create that letter and for us to maybe put it on the consent calendar or something like that. The state, does need this relatively soon so that we can just help the state and their efforts to appeal. I will say that I was just super grateful they were willing to go ahead and clean it up, even though they didn't know they would get reimbursed. So I want to be a good partner to them and help them with this. And that's all I have.
Anything else, Casey?
I just would add that last weekend we had the second FEMA re-engagement event. The first one resulted in around $90,000 going back to fire survivors. So we don't have the data yet on the last weekend, but when we think about recovery as a very long process, things that we do to stay proactive for folks in North County are really coming together still. So we'll keep at it. Thank you.
All right, I'll go back to Commissioner Jacobson. I'm certainly supportive of a letter requesting reimbursement for the cleanup of the Salmon River Mobile Home Park. And does staff have the appropriate information, or Commissioner Jacobson, can you get it to staff?
Yeah, I sent what Mary Camarada from DEQ sent me in terms of the frame kind of the state is using for this second appeal and the letter that the state has written. So Council Ewell has that.
Okay. Well, I think each of us can look forward to that and have our signatures added appropriately. Not to speak for Commissioner Hall, but I do see her nodding her head affirmatively.
Definitely. Definitely.
All right, thank you. All right, if there's nothing more on the Echo Mountain update, we'll move to the COVID vaccination update, and welcome back Interim Public Health Director Florence Portal. There we go.
Thank you. Good morning,
Good morning.
commissioners. Okay, COVID-19 update. Let's do this. Okay, as usual, I like to start with the Oregon EpiCurve. The data is current as of yesterday early morning. So this is data from actually the 23rd. But as you can see, we're still flirting with the 3,000 cases reported on a daily basis. Next slide, please. So I don't know if you remember, there was a projection done by Oregon Health Science University a few weeks ago, really warning that likely by Labor Day weekend, we would have over 1,000 COVID-19 positive patients in the hospital. As you can see with this graph that was updated yesterday by the Oregon Health Authority, we are at the 1,000 mark of people hospitalized with COVID-19 throughout the state. Next slide, please. So like I said, as of yesterday, 1,000 people hospitalized with the virus. So if I compare it to last week's number when I reported, this is 162 more people being hospitalized with COVID-19 than last week. Out of those 1,000 individuals, 28%, 283 are in the ICU. So the capacity for ICU bed is a little bit less than it was last week. Last week we were at 10% capacity. This week was about 7%. As you can see on the graph, really what we're seeing throughout is that the people who are becoming a case are okay, hold on a sec, because I want to make sure that what I'm going to say here is, you know what, I did this too early this morning, and I thought this slide was telling me, this graph was telling me something, but I'm afraid it might be telling me something else. So I will not discuss that graph, if that's okay. Next slide, please.
Director, yes. If I may make a suggestion, if we go back to that slide, because the scale on the left-hand side is so large to reflect the number of people that are hospitalized, I think it misrepresents the severity or the increase in the number of people that are in ICU, or in this case, deaths or hospitalized. So it might be visually, again, I'm a visual guy, more effective if we had one slide that showed the hospitalized patients and then another slide with a different scale for the number of people, the deaths or the people hospitalized or in ICU, that sort of thing, if that makes any sense.
Right. I believe this slide was to show that pretty much this is for the breakthrough cases. This is out of the breakthrough report that the Oregon Health Authority looked at. So if you see the gray line is showing us, okay, we're getting more and more breakthrough cases, right? But if you look at the death amongst people who were vaccinated and the hospitalized rate amongst people who were vaccinated, it's still very, very flat. And so what it's showing us is that our current vaccines are really good at protecting against hospitalization and death, less so at protecting against mild infection. And this is because, and we talked about this a few weeks ago, we have relaxed a lot of other protection measures, and the Delta variant is more contagious. So the vaccine is not as efficient as protecting you against a mild infection of COVID.
Okay, thank you.
Can I ask a question? Two questions actually about this slide. One is this ICU bed and hospitalization, is that including pediatric cases? I mean, it's everybody in Oregon, adults and kids.
Yes, I believe so.
Yeah.
But I will discuss specifically the pediatric cases.
Great, thank you. I mean, that is really heartbreaking. And then additionally, and I've kind of said this before, but I think it would be really nice every week when we have this presentation to get an idea of where are we at locally with our bed capacity.
Yeah, it's coming
because
up too.
we don't have, 1,000 beds. We have very few. So
Mhm.
All right, back to you, Florence.
Okay, so to answer your question, Commissioner Jacobson, I thought it was important for us to start. Next slide, please. It was important for us to start looking at pediatric cases throughout the state because
I'm sorry I jumped the gun, Florence. Go ahead.
Yeah, no worries. No, that's good. See,
All right,
you're-
like minds.
Yeah, you're on top of it. So as you mentioned, we're seeing definitely an increase in pediatric cases. And as you know, I think if we compare the curves and the epi curves in pediatric patients and adults, you can see a similar trend, right? This is the you have the fall winter surge and then the spring break surge, and then now the current surge with Delta. And so those are concerning because, we're yet to have school start again. And so it is possible, even though, so let me do a few things here. So it is possible that with school starting, we might see more cases. However, what we've seen over the past school year is that usually the transmission of the virus does not happen in the school setting. Usually what happens is that the transmission happens outside of the school settings, and then the students are coming to school and then they're bringing that disease in the school setting. So this is why it is so important. Usually, the transmission has happened either in the household or in extracurricular activities and things like that. So this is why it's so important for people who live with children who cannot yet be vaccinated to really consider getting vaccinated so that they do not transmit the virus to their kids. Next slide, please. Okay. I'm gonna let you take this in.
I'll note the positivity rate is down.
Yes, so I can explain that in a minute. So at the beginning of August, we were telling you that we thought we were on track for at least 4 times more cases than we had in July. Well, we've passed the 5 times more cases, and so we were well on track for 6 times more cases. Needless to say, our team is underwater. We were behind in being able to reach out to people and have a conversation, try to identify contacts. So we're asking people for patience and also for people to take the steps I will describe a little bit further when they learn that they're a positive case of COVID and or when they're exposed to a case. Unfortunately, last week we had a death due to COVID. Our hospitalizations are, I would say, really high. They are the highest we've seen in Lincoln County. We currently have 7 COVID positive patients in the hospitals in the county. 5 of them are in ICU beds. So far, we still have a little bit of capacity. I also want to debunk a rumor that we've been hearing that people in the hospital are not Lincoln County resident. Everybody in the hospital is a Lincoln County resident who has COVID-19 at this time. So as you can see, our community transmission is through the roof, 493 new cases per 100,000. It's extreme risk category. You know, the test positivity, this is good. It's coming down. So I am thinking what the reason why is that Samaritan put some testing back online. I believe we started last week. And so by, you know, ensuring there is more testing capacity, more people are going to be tested, and likely the percentage of people coming back positive is going to go down a little bit. But this is still really, really high. This is twice as high as the highest number we would like to see. So yeah, that's what's going on these days.
Mr. Chair,
Yes, go ahead.
a question if I could. So
Please.
532 cases so far for August. That is the single largest total during a month since we began, correct?
Absolutely correct. We are, our highest month was June of 2020 when we had this really large outbreak at Pacific Seafood. And I believe our total cases that month was 305. So we're almost double that.
Wow. And I am more than a little concerned about the situation with in-person education resuming, given the fact that this will be the first time students are back in classrooms since the Delta variant took over, and given its high contagion rates. Well, it's concerning, I know, and I've heard from a lot of parents who are deeply worried about what's going to happen.
Right. So I understand the concern and the anxiety. So a few things that I would like to offer. One is that you know, the schools and the school district have to follow a very clear guidance when it comes to masking requirements and distancing and hygiene practices during the school day. So I think this is definitely going to be very helpful. Like I mentioned earlier, really the transmission, at least the way we witnessed it last school year, was really not happening within the school setting, but rather outside of it. So we're hoping that we're going to see something similar. I also want to reassure folks that we're working extremely well with the school district. With the school nurses, that we have a very direct line of communication, and that we are planning on ensuring that you know, we will be a resource to them whenever they need it. So this is going on. The other thing that I want to offer is we will be working with the school district to hopefully bring back some vaccination clinic within the school setting. We haven't nailed yet the logistics of it and specific dates, but we had a very successful, a few very successful vaccination events just prior to the school stopping for summer. So there will be more opportunities for eligible kiddos to get vaccinated. So those are 12 years old and over. And the last thing is that we're awaiting, hopefully this fall or this winter, an authorization for some of the vaccines to become available for children under 12 years old. So, you know, I understand the anxiety. I think it's very important to remind children how to wear their mask, maybe have them practice mask wearing prior to going back to school. Make sure that you discuss with them how it's important to wear a mask to protect themselves, but also to protect people around them. Remind them about hand hygiene and cough etiquette as well. Even if you're wearing a mask, you can still cough in your elbow. And so this is what I have. I hope that helps people. And of course, you know, as soon as we have more information, we will let you know and let the community know. Next
All right.
slide, please.
Thanks.
Okay, so this is a different way to show you kind of our epi curve and our number of cases in Lincoln County. And this is a curve that is very similar to the epi curve that the state of Oregon is seeing. So very, very steep acceleration in the curve at the beginning of August. Next slide, please. Thank you. So we discussed the hospitalizations. They're definitely, increasing. 70.5% of the cases that have been hospitalized are among the unvaccinated in Lincoln County. And if you compare hospitalizations so far between July and August, we have about 83% increase. And as I mentioned earlier, this is the highest we've seen hospitalizations for COVID-19 in Lincoln County at this time. 7 COVID-19 patients in the hospital. Next slide, please. Okay, so when we look a little bit more at what's been going on in August. So week by week, so blue is the first week of August, orange is the second, and yellow is the third week of August. We're seeing kind of an increase across the board, aside from the 12 to 19-year-old. I'm starting to get concerned. I was not too concerned with the 50s, 60s, and 70s, but now I'm looking at those age categories and I'm starting to be a little bit concerned. We have had a few cases in long-term care facilities, mostly in staff members. We have very high rate of vaccination amongst residents, but still we know folks are, most vulnerable in their older age. And we also know that those people were amongst the first folks to be vaccinated. And we're seeing data coming out of Israel showing that the vaccination protection is winning off after a few months. So we're going to be watching this really closely and see what next week brings. But pretty much we're seeing now increase across the board for all age category. And really to remind, I didn't ask our epidemiologists to pull the breakthrough data, but we have been seeing between 80 and 85% of the cases we're seeing are amongst people who are not vaccinated. So next slide. And actually, please go back because I'm just seeing, I think there was an error. So it's 551 cases as of this morning, not 532. We added 19 just this morning. Okay, so, you know, why is this happening? I think, you know, when talking to people, it seems like some of us might not yet be well aware of the surge that is happening throughout the state and in our county, and why that is. So we have a variant of this virus that is extremely contagious. This is the Delta variant, 3 times more transmissible than previous versions of this virus. 1 person infected can infect between 5 and 8 people. Definitely, we don't have, even though in Lincoln County we've done a really good job at vaccinating 75% of our population eligible for the vaccine, is still not enough people vaccinated. So it's really important that you know, we get more people vaccinated. And also, I mean, another reason is that at the beginning of summer, we lifted the restrictions and the additional layers of protection. You know, we lifted the mask mandate, and everybody started gathering again and not necessarily keeping their distance. And so these are some of the reasons that I'm explaining the current context. Next slide, please. Okay, so what can we do to slow that prediction? Once again, this is the rate of COVID-19 cases by vaccination status. The gray are the people who are vaccinated. The yellow are people who are not vaccinated. You see the spike here in cases. July, August is very clearly amongst the vaccinated. This is a graph that discusses Oregon as a whole. So what can be done? 1, getting vaccinated. Most important measure to be taken. This is the measure that is going to protect people the most. Second measure, wear a mask in public settings indoors, and as of and some people do not seem to know that yet. They might not have received the new guidance, the new requirements. There are still a lot of places where people are not requiring to mask or are not masking themselves, and this is a problem. So masking in indoor settings, and starting this Friday masking in outdoor setting. And then the third thing to consider is really limiting your gathering, and possibly like staying home as much as possible, or away from crowds, and maybe you know, rethinking kind of like the amount of people you're getting around. Next slide, please. Okay, so I also wanted to rediscuss the COVID symptoms, because I had a few encounters this week with people telling me, oh, is this a symptom of COVID? So yes, sore throat is a COVID symptom. Yes, fever is, cough, shortness of breath or difficulty breathing, fatigue, muscles or body aches, headache, new loss of taste or smell, runny nose, nausea or vomiting, diarrhea. If you're vaccinated, your symptoms might not be as severe as if as if you were not vaccinated. However, if your throat is sore and you're coughing, you might, based on the data and the level of community transmissions we're seeing right now, you might consider, getting tested. Next slide, please. Okay, so what do you do when you have COVID symptoms? Of course, if you can, go get tested. As you can see at the bottom of the slide on the right-hand side, there is a link that gets you to our website, and we're really trying to keep that page up to date so people can refer to it and make sure that they have the latest information for free testing and any other testing available in our community. And we're working to trying to make even more testing available. So if you test positive, please isolate from others. Do not go to work. Stay home. Stay away from people in your home if you can. Wear a mask if you can't really be completely isolated. We will reach out, we being public health, we will reach out to you as soon as we can. As I mentioned earlier, there are so many cases that even though we are bringing support staff and more people to help, we still are a little bit behind. So the other important thing is that if you get tested with one of those home kits tests that we talked about earlier, and you get a positive result, it would be really great if you could report that result to us. Right now, we ask you to call us, but very, very soon we will have a little survey on our website that you can fill so that you don't have to worry about calling us, and we will still get that information and be able to reach back out to you. If you know, if you know that you're positive for COVID, help us out and let your contacts know that you have been exposed, that they have been exposed to COVID, and so that they can also take some precautions and wear their mask, and if they're not vaccinated, quarantine. Next slide, please. So like I mentioned earlier, we are trying to diversify testing options for community members. We are keeping that list of where people can get tested. This is on our website. Great, this is here. Thank you so much, Casey. And then on the second line, where can I get a COVID test? And this is a document that I believe was updated this morning with the latest information. Thank you so much. Next slide, please. Okay, so we talked about what if I'm positive with COVID? What if I'm a contact of a case? Well, if you learn that you were exposed to a confirmed case, then here's what we're asking you to do. If you're not vaccinated, please quarantine as soon as possible and monitor for COVID symptoms. If you're starting to get those symptoms we talked about earlier, you can possibly get tested, but pretty much stay home and away from working people. If you're vaccinated, you don't have to quarantine. At least, we're hearing that it's going to be a new guidance, so that might change. But at this particular moment, you do not have to quarantine. You can quarantine, but we are asking you to wear a mask for 14 days and monitor for symptoms, and possibly test at 3 or 5 days after exposure. Next slide, please. Okay, so there have been some news regarding the COVID-19 vaccine. Very good news is that the Pfizer vaccine received full FDA approval earlier this week. So this is hopefully going to help people who were waiting for that approval to take the steps to get vaccinated. As you may have heard, vaccination is now mandatory for healthcare workers and school staff throughout Oregon. As we discussed last week, for people who are immunocompromised, immunosuppressed, there is the possibility for those individuals to get an additional dose of vaccine. And then we're starting to gear up for the possibility of providing booster shots for high-risk individuals in the fall. And so those would be for people who have received their second dose of vaccine at least 8 months ago. We will, of course, bring more information to you as soon as we get it, but I just want to let you know that we're already, as a community, thinking about how we will be offering those booster shots to people who fall in that category.
Can I make a comment on that? I believe there is already some, clinics through Samaritan offering booster shots, because I know several people that are immune compromised and just got their boosters. So I think there is some providers doing that.
Two different things. So for booster shots are not for the immunocompromised. The immunocompromised folks are eligible for an additional dose, which is not the same thing as a booster shot. And so the reason for that is that people who are immunocompromised might not be as, their immune system does not react as well to vaccination. And so it's been shown that a third dose of the vaccine might help to gain a similar immunity status than a person who is not immunocompromised might have gained with only 2 doses of the vaccine. The booster is for people who are not in the immunocompromised categories, and it's just like, when we say, you need the booster for the pertussis vaccine, or you need your booster for the MMR. This is because we need to boost the immunity you already acquired with that additional dose. And we've been asked to really be careful in how we're using the words. So this is why I'm taking this opportunity to try to explain the difference. So yes, additional doses for people who are immunocompromised is available at this time, not for anybody else. Next slide, please. Okay, so our vaccinations, we're seeing a slight increase, but we're still at a plateau in terms of vaccinations. Next slide. I was surprised to see such a small percentage of change over the last week, and we identify why that is. We're a little bit behind in data entry. So we are likely have a larger change compared to our prior percentages. But right now we see that a little bit over 75% of eligible people being vaccinated. Next slide, please. So as you know, a lot of venue offer vaccinations in our county, of course, pharmacies, primary care offices, and the public health mobile clinics. So this is a list of where those clinics are happening in our county. As you can see, it's very much throughout the county. We have clinics in Lincoln City, in Otis. I believe the events in Siletz has been canceled. We have clinics in Newport, in Waldport, in Yachats, and in the Nashville Blodgett area. So plenty to choose from. I want to remind people that those clinics are open to walk-ins. We have 3 different vaccines available for people to choose from if they so wish. We're taking first doses, second doses. It doesn't matter, just show up if you need the vaccine, and we will be gladly administering it to you. Next slide. Next slide. Okay, and I also just wanted to tell you that, of course, and you know, we because we're considering those, we're in the planning stages for those booster doses that are likely going to arrive in the fall. We can't do that on our own. So our multi-agency coordination group is still going, and you know, we are planning and working together to serve the community as best as we can. Next slide. I think this is the question slide.
Questions or comments, commissioners? Commissioner.
I don't think I've got a question, just a comment. Really sobering information, and as awful as a lot of these numbers look, I think about the fact that, for example, 3 Southern Oregon counties are among the worst in the United States right now for the virus. And this is what happens when you don't have community leadership or the community at large taking it seriously enough. So applause to everybody on our public health team, the greater community team, and the 3 out of 4 people who have done the right thing in the county and gotten vaccinated.
Commissioner Jacobson.
Claire took the words right out of my mouth with what she said. And, you know, I think if people have seen what's going on in some of our other counties, Jackson and Josephine and Curry, it's just a nightmare. I think from the beginning of the pandemic, you know, losing hospitals and losing the ability to take care of people was always what we were trying to avoid, or at least that's always what I was trying to avoid. And I believe the board was. And those communities are now in that situation with the largely unvaccinated crowd needing medical care. Got a letter this morning from Tillamook County that they have seen increased deaths. And when I say increase, I think they lost 5 people to COVID over the last 5 days. Doesn't seem like a huge deal. Certainly it is to those families, but it's a very small community, small like ours in some ways. And now they have no morgue space. So they're actually asking the state for a refrigerated truck. So I just want to remind people that it doesn't take a lot to tip our medical system here. Mm-hmm. We are not Portland. We are not Corvallis. We are not Salem. We are not those places. We have very limited medical care, as all of us know living here. And it doesn't take a whole lot to take us down. When Florence showed the 3% hospitalization rate, 3% hospitalization rate doesn't mean there's beds for 3% of the people. I see lots of things online with people saying, well, the death rate is so low. Well, I hope so, because the number of beds we have in this community is also very, very low. And once you lose your hospitals and you're not able to take care of people, obviously that death rate goes up because you can't provide adequate care. So I will just say that just like Commissioner Hall said, I'm really proud of everybody for being willing to get vaccinated. I know not everybody who did were people that necessarily wanted to or necessarily were happy about that. I know we have someone on our own staff in the county that has a very big fear of needles and said she had to do a lot of work, personal work to kind of be able to do that. So I recognize that it was not an easy decision for many people, but I'm just grateful for so many of you that have. And I'm just really hoping that we can get through this. It is not looking good for many communities, especially those with a lower vaccine rate. But we still have a large group of our population that is still unvaccinated. And, I do worry about that group of people overwhelming our medical system. And, so I'm just kind of hoping that everybody can continue to take precautions for a while so that we don't end up in the same situation that some of our other counties are dealing with.
Okay, and I think, there's, depending on how you look at the situation, I think we should be very proud of the fact that, again, we're one of the counties in the state that has the highest vaccination rate. But frighteningly so, the number of cases that we're seeing within our county relative to what we've seen within our county are increasing at a frightening rate. So again, I think the best thing that people can do is get vaccinated, wear a face mask now, whether it's indoors or outdoors, unless when you're outdoors, you're really isolated individually. And social distancing, be aware and avoid those close interactions with people. Those are the best things that we can do at this time to fight the spread of the virus. And the trends are frightening. And as a former banker, you start to look at 3 or 4 or 5 months, and the data is getting, again, the spread of the virus is becoming frightening. So I appreciate the detailed information you had, Florence. I have gotten a question, and I don't think you have the answer, but maybe you could provide it next week. Is there a meaningful difference in the number of cases in the different areas of the county? Maybe you could provide some information on, north, south, east, west, that sort of thing.
Yeah, it's interesting. You're the third person asking. And so we started to think about this yesterday. I don't think that what we were able to pull really is meaningful for this week, but I will definitely be sure to ask our epidemiologist to look at that, because what was missing from what she pulled was I would want to compare based on, like, let's say, not to name, let's take Newport. I would like to see, okay, what is the percentage of the Newport population against, the county population, and then looking at what their proportion of cases from the Newport area, just to see, if it is a similar proportion or if it is like way low, way high. And also I would like to see possibly vaccination rates to see if we can show some correlation. So we have a little bit of work to do here, but I will definitely ask Callie to work on this.
Well, speaking as a East County resident, I know some of the slides we've seen previously show that the East County is, relatively speaking, at a lower rate of vaccination than other parts of the county. So we'll look forward to maybe some more information along those lines next week. Any last comments, commissioners? Florence? All right. Thank you again for a lot of information, but a lot of valuable information. Appreciate it. Keep up the good work.
Thank you.
All right. Next on our agenda would be commissioner reports. Commissioner Jacobson, you're at the top of my list. at least visually.
I like being at the top of your list. Thanks,
Well, I
Commissioner.
didn't want to
Hahn.
offend, I didn't want to offend Commissioner Hall, you know?
I have nothing further to report other than the wildfire report and other things I reported on previously. Thanks.
Commissioner Hall, you're
Nothing
also at the
further.
top of my list as fellow commissioners.
Okay, nothing further to report. Thanks.
And I have nothing further to report either. Next, we have public comment. Casey, let's first go to the public comment that we received through Smart Sheets or emails. And again, this would be information that was received through last evening.
Okay, so the first thing I'm going to show you is our Smart Sheets document. So stand by, and I think I need reading glasses, I'm starting to realize.
Welcome to the club.
Yeah. Okay. So this is our Smart Sheet, and the second to last item we received was put into the public record for vacations on that agenda item. So really this week, the only input we've received through Smart Sheet is from John Lynch, and that was in regard to STRs. So just so folks can understand, when we go and look at the short-term rental licensing page and we scroll down, we can see we've added that particular piece of input to the STR page. So for today's meeting, nothing through the Smart Sheet, and we don't have any other input that I'm aware of through other means, just direct emails, for example. So.
All right, anybody attending virtually to make a public comment that you're aware of?
So just for everyone that's here, it doesn't look like it to me, but remember, if you could raise your hand, if you do want to provide constituent input, that would be our cue for, identifying anyone that wanted to do that. And I don't see anything. And Chair, just a reminder, on the commissioners section of the county's website is links and details about how folks can participate in our meetings if they choose to.
Okay. Well, again, this is something we're doing to try to facilitate public comment during the virtual meeting. And as I've indicated earlier, I expect that we will continue these virtual meetings for some time into the future. All right, any other business to come before the board at this time? If not, next meeting of the Lincoln County Board of Commissioners will be held virtually on Wednesday, September 1st at 10 a.m. And until that time, we are adjourned. Thank you all.